Ongeza sauti kidogo, ongeza sauti kidogo.
Atokoe mujan amutao alikufa kwa sababu ya dhambi zenu neweka. Teni za Mungu Baba, kwa sababu hizo ndizo za tuongoza. Tusizivunje sheria za Mungu, kwa sababu hizo ndizo za tuongoza.
Sababu gani?
Kwa sababu hizo ndizo za tuongoza. Kwa sababu hizo ndizo za tuongoza. Kwa sababu hizo ndizo za tuongoza. Kwa sababu hizo ndizo za tuongoza.
Bwana Yesu ndiye mchungaji wangu, sitapungukiwa na kitu hata kamwe. Unilaza katika majani mabichi, unilaza katika majani mabichi, majani mabichi niweka. Tunamwimbia Mungu wetu, tunachezea Mungu wetu, tunamwimbia Mungu wetu, tunachezea
Mungu wetu,
Baba, Yesu ndiye mfalme. Cheze na Yesu, cheze ya Bwana Yesu, ruka rukia Bwana Yesu, rukia Bwana. Tumekuja kuwaeleza mpya na mambo inezingala elizweni lisoloko lisizokwe.
Five, 4, 3, 2, 1, mic check. Asante sana. Karibu.
Thank you, thank you. 1, 2, mic check. Hello, hello, hello. Good morning, everyone. Oh, thank you very much. Before you is Hosea Katila, and I'm here to do one thing. Thank you very much for keeping quiet. So I'm presenting a spoken word titled Shoes with Issues on Mental Health. Thank you very much. Wow, 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 wow. Wow, 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 wow. Aliniambia eti ni put myself in her shoes nami nikachoose kurefuse. Aliniambia ni put myself in her shoes nami nikachoose kurefuse. Na si eti nilikuwa na die. I just didn't want to die before my time because her shoes have issues. Na si siri tena. So hawezi niambia kuwa yuko sawa. Hawezi niambia kuwa she's used to it because even her own food she has often refused to eat. Aliniambia nami nikakataa. Because nilikuwa nimemwambia choose wisely with things to use. Yeye akaamua kuendea substances, aka-use, aka-abuse, aka-misuse. Saizi yuko confused with issues. Nilimwambia ujana ni moshi, naye hakujua penye moshi hapakosi moto. Saizi anateketea, si msoto si mtoto. Nilimpeleka WhatsApp group ya mental health awareness aka-left. Saizi akosi kulia. Nilimpeleka pitch nikamwambia tufanye zoezi angalau muhimu hata angekuwa gola. Akajam. How come saizi ameshika ball? Nilimwambia hata size 8 huwa anachagua which size of shoes to buy na nameless pia huwa anaulizwa anaitwa nani. But now things have changed. Hayo mawazo bora ambayo alikuwa nayo every time saizi hatuyasikie eti bora mawazo. Hiyo nyumba bora na azma bora aliyokuwa nayo maishani saizi hatusikie eti bora maisha, bora azma. Sababu gani? Alimake decision hataki kamsababishia matokeo hataki. Cheki, alifanya vitendo hataki. Saizi ana ujauzito hataki wa mtoto hataki, nasikia babake mtoto pia hataki. So vile vitu ameuse vimefanya lose weight na alirealize ikiwa too late. So saizi akivaa nguo na inamvaa na kuhang loose kama gunia la makaa. So ukimpata amekaa with a lot of issues kwa kichwa kama kichaa. Now depression is the situation at hand. But God need the head all around because ye yuko everywhere. So nilimwambia because hawezi aka stand on her feet. Viatu vyake vinamfinya vimfit, but anaweza go on her knees because her knees itasikika na Muumba, and then God is able to give her a shoulder to lean on. Nilimwambia ati accept Christ conform our new creation ata change. So nikamwambia form si kuwaza sana, form si kuwa suicidal, nikamwambia form ni ku accept Christ and form our new creation. Si mtoto wake atakuwa baraka. Kumbuka vile Paul alikuwa kabla hata andike mmoja waraka, si alibadilika haraka. So ye pia siwe na mashaka. Just like Paul alichange from Saul, ye pia anaweza change akawa new soul to Christ. So tusiruhusu depression ituangamize kabla tuiangamize. Tusiruhusu stress zitu stress kabla tuzitrace na kuzierase. Tusiruhusu equalize. Prince Hosea. Thank you very much.
Check. 1, 5, 4, 3, 2, 1.
Good morning. My name is Bartholomew, and I have my friends, and we are going to do a skit on substance abuse and gender-based violence. Thank you. Leo lazima nikushikie mzinga. Wazi jo, wazi. Siku imekuwa mrefu. Eva. Yaani si saa nne na Eva hajaingia kwa nyumba. Saa 4:30. Huyu mtoto aliingia hapa first year, nimemuosha, alikuwa na vadi kamisi. Nimemuosha saa hii. Leo atakiona.
Check.
Babe, sasa limechoka. Umefika saa ngapi kwa nyumba?
Unaita nani babe?
Aki babe, nimetoka hosi. Skipoa.
Sasa ni saa ngapi unaingia kwa nyumba?
Babe, nimekwambia nimetoka hosi. Si skipoa ki, si sahi please.
Hosi ya nani imefunguliwa saa hii?
Babe, nimetoka hosi.
Na kuongelesha, hosi ya nani imefunguliwa saa hii?
Nimetoka hosi.
Na unanuka pombe?
Babe, nimekwambia nimetoka hosi.
Unanuka pombe? Hosi ya mabashi?
Nimetoka hosi.
Hii ni hosi ya nani?
Nimetoka hosi.
Babe.
Hii
ni hosi ya nani? Unatoka kwa hospitali ya nani?
Babe, ngoja. Si tusikia mbona nimetoka hosi. Babe, niko na ball. Babe.
Ati?
Niko na ball.
Eva uko na ball.
Babe.
Uko na ball? Ya nani? Ati Lamek. Unadhani sijui Lamek? Ati sijui ulikuwa group discussion. Hiyo ball ni yangu. Hiyo si ball yangu. Tunaenda kutoa, umesikia? Nitakuua, umesikia? Nikisema tunatoa, umesikia?
Hapana. Babe, hapana. Sawa.
We, kesho saa 3. Nikirudi hapa nipate umeoga. Acha kunishika.
Hapana, pole.
Acha kunishika.
Pole.
Acha kunishika. We nimekuosha we alafu unaniambia uko na ball. Na leo unalala kwa kiti.
Eva, nini nasikia manduru kuolova? Nini mbaya? Sorry, pole mami, simama. Nini? Amekufanya nini?
Amenichapa.
Tena. Utaka kwa relationship hadi lini? This thing is getting toxic, bwana. Hey, utajua hakupendi siku tutakuzika. Nini imekuweka hapa?
Niko na ball.
Uko na ball yake. And now, una plan?
Anataka nitoe.
Na wewe? Hautaki kutoa?
Nitatoa.
Utatoa. Unatoa kwa nini?
Nampenda.
Hiyo kitu ni dangerous. Unaenda kutolea wapi in the first place?
Sijui, amesema kesho 9.
Aren't you afraid that you might die? Hapana. Now that unogopa atakuacha, I have an idea. Utanisikiliza? No, just listen. Sikiliza. Niko na idea Eva. So nisikilize tu.
Na unaniumiza. Mimi nikupigia location.
I want to help you.
Hapana, wewe utaleta vita. Mimi sikuambii penye.
Trust me.
Unaniumiza mkono.
Sorry. Trust me.
Penye tuko.
Ni sawa. Nisikilize. We shall do this. Tunaenda kwangu, uende, uoge, ukule, ulale. Then kesho we are doing exactly that. Trust me, I got you. Sawa?
Sure.
I am positive.
Ni pretend nimefaint.
Si ndio?
Na atajua.
Wewe simama.
Kishash. In heaven there is no beer. That's why we are drinking here. And when we are gone from here, your friends will be drinking your beer. In heaven there is no beer. That's why we are drinking here. And when we are gone from here, your friends will be drinking your beer.
Jemo.
Niaje
manze.
Jack. Jack.
Kochonjo?
Niko freshi.
Wacha nikuashie. Najua ubebangi nare. Kwanza yangu iko wapi? Kai.
Toa bwana, toa.
You must invest in these things, Jemo.
Lakini
acha nikuashie. Ujui bwana Jemo.
Kishash. Sasa. Umenileta customer. Yeah.
Simwangalie hivyo sana Jemo.
Nisimwangalie.
Kuja hapa. Jemo. Nadai
miezi ngapi? Unajua last time kwanza
ongea na sauti miezi ngapi?
Mwezi moja. Mwezi moja kazi rahisi hata hii haitaki makasi.
Okay.
Hii ni 1 2 tumemaliza biashara.
Sawa. Haya, chukua. Kuja hapa wewe.
Cheki. Chill madam. Na hii si mbaya.
Wacha nikusaidie.
Madam. Twende.
Rada, ushamaliza? Haraka aje leo.
Sijamfanyia kitu. Amefaint. Cheki, Jack, sivyo. Sijamfanyia kitu. Hata sikuwa nimetoa makasi. Ndo nilikuwa nashika tu. Hata sikuwa nimeanza.
Kwani ilikuwa ushike demu wangu tena?
Cheki, sijamfanyia kitu. Amefaint.
Umemfanyia nini wewe?
Cheki, sijamfanyia kitu.
Umemfanyia nini demu wako?
Cheki, sijafanya kitu mzee. Cheki, mimi sijafanya kitu.
Walai amka wewe. Daktari. Hapa hivi atupige drama walai.
Cheki.
Walai na hadi roho.
Hello. Daktari. Siweke pattern boss bana.
Wewe pia nunua credit bana.
Hello. Cheki bana, wewe baki hapa na stress zako. Mimi sitaki kazi.
Hata hizo bana Jemo. Eva hata jokes. Wewe hata jokes. Atuakta hapa. Wewe bana.
Wewe. Umemfanya nini Eva?
Unafanya nini hapa?
Kwa siku moja utamuua. Umemfanya nini?
Unafanya nini hapa? Nani amekuonesha hicho?
Umemfanya nini wewe? Umeita daktari? Umeita daktari?
Daktari.
Enda ukamuite. Unangoja kufe.
Atakufa.
Toka. Enda.
Niende.
Unataka huyu akufe ndo ujue. Enda ukaite daktari. Unanikasirisha, toka.
Sawa.
Shenzi, umbwa wewe.
na wameenda ama ni vitu nimetumia? Si ndio hii? Si ndio hii viatu yake? Ama Mungu amemwambia atoe viatu kama Musa? Na Mary ndio mama ya Mungu, wameenda na yeye. Sielewi. Acha niingie tena. Eva ameacha vitu za dunia. Sasa
check.
Auntie, please don't chase me. Listen to my heart speak. My heart bleeds. It so bleeds. It's not my fault. This illness I got. It's not my fault. This pregnancy I got. In this world, I have no place. In my own home, I have no space. Problems from every corner to face. Let me be honest. This life is so hard to embrace. I remember it was yesterday, and life was so good, and all the promises he made. Oh, the sweet words he told me. My Jaber, unametameta, utakunywa nini? And the sweet words he told me, the sweet names he called me. My Jaber, my sweetheart, my sunshine, don't touch me, stop touching. But that is all in the past. I now live in fear. Family and friends do not draw near. Their ignorance is not fair. AIDS patients die with broken hearts. And because of that, it all hurts. Pain added to their body parts. Oh, this is sad. I beg them, don't run away from me because I'm diagnosed with HIV. Please. This is truly a bloody-borne disease. But all I need is a hug or squeeze. You, and you there, I need to be loved more and more. Come into my small world. Don't stand at the door. Sit, talk, or read me a book. Don't judge me by how I look. Let me tell you a fact. AIDS is not witchcraft. AIDS is a fact. So do not be misled. Go get the HIV test done. Of course, you must get the test done. And right now, put your mind to rest because I'm about to put my heart to rest. Bye-bye for now. Bye-bye, my friends. Bye-bye for now. Bye-bye, my friends.
Kenya science
hawana matata, hawana matata.
Kenya
hawana matata, hawana matata.
main campus
Hakuna matata,
hakuna matata. Hey,
hakuna matata,
Figa Kikuyu
hakuna matata,
hakuna matata.
hakuna matata,
Mombasa campus
hakuna matata,
hakuna matata.
hakuna matata,
Na Kisumu campus
hakuna matata,
hakuna matata.
hakuna matata.
Jambo, salamu alaikum, habari gani? Mzuri sana, wageni mwakaribishwa chuo chetu, hakuna matata iyo.
Jambo bwana, habari gani? Nzuri sana, wageni wakaribishwa chuo chetu, hakuna matata iyo. Jambo bwana, habari gani? Nzuri sana, wageni wakaribishwa chuo chetu, hakuna matata. Mungu nifanye niwe chombo cha amani yako, nisambaze amani duniani kote. Mungu nifanye niwe chombo cha amani yako, nihubiri amani kwa Wakenya wote. Mungu nifanye niwe chombo cha amani yako, nisambaze amani duniani kote. Mungu nifanye niwe chombo cha amani yako, nihubiri amani kwa Wakenya wote.
Palipo chuki na ugomvi nilete upendo,
Ili Wakenya wote waishi kwa upendo wa kweli.
palipo chuki na ugomvi nilete amani,
Ili Wakenya wote waishi kwa amani tele.
popote palipo na mtengano nilete umoja,
Ili Wakenya wote waishi kwa umoja wa kweli.
popote palipo na mzozo nilete amani,
Ili Wakenya wote waishi kwa amani tele. Mungu nifanye niwe chombo cha amani yako, nisambaze amani duniani kote. Mungu nifanye niwe chombo cha amani yako, nihubiri amani kwa Wakenya wote.
shaka nilete faraja,
Ili Wakenya wote waishi kwa upendo wa kweli.
majeraha nilete
Amani, ili Wakenya wote waishi kwa amani tele.
ya kisiasa nilete umoja,
Ili Wakenya wote waishi kwa umoja wa kweli.
palipo vita vya ukabila nilete amani,
Ili Wakenya wote waishi kwa amani tele.
Baba Mungu
Kweli mimi nimeshajitolea
sehemu zote zote za Kenya.
Kuhubiri amani kwa Wakenya wote. Tukomeshe vitendo vya uharibifu.
Madaraka yetu.
Tuijenge Kenya taifa letu.
Baba Mungu,
kweli mimi nimeshajitolea
sehemu zote za Kenya.
Kuhubiri amani kwa Wakenya wote. Tukomeshe vitendo vya uharibifu.
Madaraka yetu.
Tuijenge Kenya taifa letu.
Chuki, hasira, fitina na vita vimetawala ulimwengu.
Ewe Mungu mwenye upendo, tujalie upendo wa kweli. Tunapoishi na wenzetu, hatukosi kuwa na ugomvi. Ewe Mungu mwenye amani, tujalie amani ya kweli. Tusisahau umoja wetu, tukaeneza ukabila. Ewe Mungu mwenye utulivu, tujalie upendo wa kweli. Tunapoishi na wenzetu, yatupasa kuwa na amani. Ewe Mungu mwenye amani, tujalie amani ya kweli. Mungu nifanye niwe chombo cha amani yako. Nisambaze amani duniani kote. Mungu nifanye niwe chombo cha amani yako. Nihubiri amani kwa Wakenya wote.
Upendo usambae. Ningependa upendo usambae.
Wakenya wote.
Natamani amani isambae. Ningependa amani isambae.
Wakenya wote.
Ningependa umoja usambae. Ningependa umoja usambae.
Wakenya wote.
Natamani amani isambae kote. Ningependa amani isambae.
Wakenya wote.
Yes, I greet you all. I'm Frida Nyakerario Mongare, and I'm going to present to you a poem. But just before I present my poem to you, let me introduce to you my instrumentalist, Davis Osino, who's going to be doing the instruments as I present to you this piece. So just before that, let me give you a background information as to what pushed me to write this particular piece. This poem is about 1 month ago, a 5-year-old girl was raped by a 40-year-old man. I'm from West Mogirango, Nyamira County, and that is where this happened. So this is just me thinking out loud via this particular poem, and it goes. She cried out her life. He was a guide and refuge, so she need not put on her veil. Her tears were like deluge. How on earth does such creature still exist? A masked beast in a beautiful garment. But how would she know he was a beast? Thus he acted like a parent. You are a coward, a he-goat, a monster without conscience. You ended her life with an evil motive, and you claim that as the work of the devil. It's nothing but mere evil. A child with a frail body can't be sexually attractive. You have depleted your ego and ended her life, all in the name of having libido. You have defied her right, ended her life, and destroyed her future. Now she's infected with HIV/AIDS. And they cry, please don't detach yourself from me. I'm just but diagnosed with HIV/AIDS. It's just but a blood-borne disease. So you need not keep off from me. When you knock at the door, please, don't stand there. Come and sit with me. Or maybe read me a story. Equity. Equity. Treat them with equality.
Thank you all for those wonderful performances. I would like us to officially begin our program. And by that, I would like to invite the band and the choir to please come in front and lead us with the national anthem. Once they're set up, we can all stand and listen to the national anthem. There's going to be 3 of them that they're going to perform. The University of Nairobi one, the Kenya National Anthem, and the East Africa National Anthem. So once they're ready, they'll lead us into it.
University of Nairobi, we labor all together in search for knowledge and truth. We bless and honor thee. We are the pinnacle of excellence in knowledge, knowledge to serve our motherland. O Kenya, knowledge to serve all mankind. Be not engulfed by pride. Let excellence prevail. May we all shun the pitfall of being the ivory tower. With sacrifice and dedication, our problems will all come.
Let's please remain upstanding for a word of prayer. Thank you.
We dedicate ourselves to the Lord this morning, and we pray. Almighty God, our Father, we thank you for this new day, this first day of the new month of December. We thank you for bringing us together as a university family. And we thank you for all our students here present and all those in various places as we stand here. All our teachers, our parents, all our partners and stakeholders, management of the university, you form us to be one, united together. We indeed thank you today for our University Health Services who have organized this day to continue sensitizing us on issues that affect us, and especially HIV and AIDS. We acknowledge that you know everything, O Lord, and nothing comes behind you. Continue inspiring our researchers to be able to come up with lasting solutions to the problems and the plague of HIV/AIDS. You have charged us with the responsibility as a university of forming young men and women in knowledge and character. May our young people, through your care and love, learn the ways of holiness and so lead lives that do not expose them to dangers of disease, and assure them a future that is healthy, that assures us a healthy nation, a healthy people. We pray for those who are infected with the virus and those struggling in their lives. Help them, O Lord, that they may receive the necessary health care and support, that they may not be stigmatized by all means. Give your help, O Lord, to those affected, and especially children whose parents suffer the disease. Come to their aid, O Lord, and help us open our hands to reach them and be able to give them help. To all caregivers, nurses, doctors, and all those who take care of the sick, grant unto their hearts your love, that they may carry out such duties with humanity, and especially to those who are suffering more. May they do this with an uncomplaining patience, knowing that they participate in your healing ministry. And now, Lord, we ask you to bless this day and all the activities that we carry on today. Remind us that you are our Father, you care for us, and you love us. And we ask this through Christ our Lord. Amen.
Thank you. You may now take your seats. Good morning, everyone. How are we feeling today? Are we good? Hands up if we're feeling good. Hands up, hands up, hands up. Thank you. I know it's been a long morning. Thank you so much for your patience, for those of you who have been waiting, and thank you for those who joined us on the other side. Allow me to go through a list of protocols before we begin the program. National Government State Department of Gender, Deputy Director GBV, representing Her Excellency Minister Ms. Aisha Jumwa, Ms. Emily Opati. Nairobi County, Member Nairobi County Government Health and Reforms, Dr. Anastasia Nyambita. Nairobi County Commissioner, Ms. Flora Moroa. The Denmark Embassy, represented by Halima Abdi. Netherlands Embassy, represented by Iris Lunen. PEPFAR, represented by Agnes Ndungo. Our hosts, the Vice Chancellor, Professor Stephen Kiama. Deputy VC, Professor Julia Songengo. We have UN Women, Kenya Country Representative, Ms. Anna Mutavati. UNAIDS Community Support Advisor, Ms. Ludfin Bunde. Gender and Do No Harm Advisor, Mrs. Jane Minor. UNRC Primary Healthcare Window Coordinator, SDG Partnership Platform, representative of the Resident Coordinator Office, Ms. Irene Karanja. SRHR Alliance, Ms. Doris Katia, APHRC, Patterson Siema, Dr. Sam Denya of the Gender Violence Recovery Center, Gilad, Business Unit Lead, Janet Handa, Outdoora Hub Limited Managing Director, Robert Kamaru, lecturers, students, media, the faith fraternity, allies, all protocols observed. Once again, good morning. It's such an incredibly important day. Not only is it the 1st of December World AIDS Day, it's also the launch of the first gender desk on campus in Kenya. So you guys are pioneers. I'll talk a little bit about myself because of the interest of time. I want to make sure we give everyone a chance to make their remarks. I'm Janet Bogwa, and a little bit about how I landed here today. In 2013, I was a news anchor on Citizen TV. And there was a story that aired called Periods of Shame. That story showed girls using chicken feathers, goat hide, and soil because they did not have access to sanitary pads. That story not only changed my life and birthed the activist in me, but it also allowed the nation to realize that we have a problem, that we are not giving everybody equality. Men, women, children, that there's no equality. And so years later, because I followed that line of wanting to hold policymakers accountable, it's allowed me to be in very many rooms. It's allowed me to be in rooms in New York, in rooms in different parts of the world, talking about gender equality, gender-based violence. But that doesn't matter as much as being on the ground and understanding how deeply these issues affect the lives of everybody, including students. Because of that story in 2013, years later, I've opened a center in Korogosho, an Inuadada center, where we talk to men and women, we dialogue with them about violence. We have trained women to make pads and we distribute them to students in underserved schools. And we support a safe house for survivors in Mombasa. Why am I saying this? At the beginning, there was an incredible skit that was done by your colleagues, and we'll see them a little later. Use your voices. Right now, you're taking your places in this auditorium, but you need to take up your space, and you need to own it. You need to own the space that you're in. When you see us here, somebody told me ni kizungu mingi. I don't know where Maxwell is. He's one of the students. We're just trying to tell you that this is your time, and that when you see all of these dignitaries here and all of the people I mentioned in the beginning, they're working towards launching policies that are going to affect your lives. Do not be afraid to push back, speak up when something is amiss. It's World AIDS Day, it's 16 days of activism. Take up your space. Silence is complicit. If you're not talking, you're part of the problem. And let's understand this fight is for everyone, men and women alike. So with that, I would like to also recognize, of course, UNESCO and the O3+ campaign. Students at the front, please wave, because we're going to be recognizing you very soon. The hikers, we're going to be giving you your awards a little later on. And we're also going to have speeches and remarks. Please listen to the speeches and remarks. Don't get restless, don't get antsy, listen. Take notes and figure out how you're going to take up your space in this collective fight to end gender-based violence. And there's also going to be free screening for HIV on campus. A little later on, we'll tell you exactly where that is. For now, I would like to invite the University of Nairobi Students Association chairperson, Ms. Melvin Thongo, to come and say a few words. Everybody, please try and keep your remarks within a good amount of time so that we can make sure everybody speaks. And once we have the first few remarks, we'll invite the students for another skit, and then we'll have our keynote speakers. So Melvin, is Melvin here? I saw Melvin earlier. Oh, fantastic. Let's welcome her warmly.
The Vice Chancellor, Professor Stephen Kema, the Deputy Vice Chancellor, Academic Affairs, Professor Julius Ogengo, ABC, Professor Margaret Hutchinson, all dignitaries present, all government representatives, all protocol observed, ladies and gentlemen, good morning. My name is Melvin Dogo. I am the President, University of Nairobi Students Association. And today, as we celebrate World AIDS Day for the 34th year, I want to call upon each one of us from all generations, old and young, to raise their voices against adolescents' pregnancies, sexual and gender-based violence, and prevent HIV infections.
We each have a role to play to protect our future and that of our society. To end adolescent pregnancies, we must protect our girls and children from sexual abuse, sensitize them on their rights, educate them on sexual reproductive health, and most importantly, call and stand against abusive men and women in our society, because we are championing for gender equity in all spectrums. We must allow these young girls to continue with their education as much as we allow our sons and boys to. At a time when the world economy is on a downward spiral, it is our role to support the girls and boys in learning institutions to protect them against predators who take advantage of their less privileged backgrounds. We must stand firm against sexual and gender-based violence in our institutions to create spaces, safe spaces, and end abuse against children, women, and men. As we continue to speak against new HIV infections, let us also extend grace to the already infected and affected people in our communities. We are all one community, and let us continue to treat each other with kindness and love. I have seen the University of Nairobi fraternity make great strides towards ending the triple threat through launching the gender desk, sensitize students on different forms of abuse, and creating safe spaces for them. Thank you to the students' body who continually raise awareness on these ills and support each other through it all. To the management, under the stewardship of the Vice Chancellor, Professor Stephen Kiama, we are continually amazed and impressed at the commitment to create safe spaces for the students and ensuring their social welfare is taken care of. It is quite an honor to see that you guys actually show up to not just champion for your rights, but also for the students. We thank you.
Thank you, Melvin. She's one of the students that we sat with a few weeks ago to debate about safe spaces, so thank you for your leadership. As we allow Hope TV to set up, and thank you for being here, I'd now like to call upon the Dean of Students, Mr. Johnson Kinyua, to also give us some remarks. We can give him a round of applause.
Thank you, Janet. The national and the county government representatives present, Professor Herbert, the Regional Director for UNESCO, Professor Julius Ogengo, the DVC Academic Affairs, invited guests and partners, University of Nairobi staff, students, ladies and gentlemen, good morning. Yeah, I'm standing in a big shoes of my team leader for the UNESCO 3+ project, Professor Luke Jaoko, who would have loved to be with us this morning, but he couldn't because of other engagement outside the country. But however, I will say that the country is endowed with young, bright, strong young people aged between 15 and 24 who are in the higher educations. About 2 million of them are there who are the prime of these nations, whom we look upon to be the productive workforce for these countries in various sectors. But these young people are prone to various challenges because of their age. They are vulnerable to HIV/AIDS, to alcohol and drug abuse, issues to do with gender-based violence, and also because of the effects of the COVID-19, which we are still coming to the tail of it. It has presented a lot of mental health challenges. And because of that, the University of Nairobi is grateful that the UNESCO came in handy when we needed a partner to hold our hand. And we partnered to develop what we call the Ladder app. The Ladder app is an application where a student can access information about sexual reproductive health, issues to do with the rape, gender-based violence, the mental health, and all other issues that the young people are grappling with. And with that, we are grateful to the UNESCO, and we look forward to continue scaling that best practice to all other universities and colleges within the country. We've also this morning launched something very important at the University of Nairobi Health Services. We call it the gender desk. And that gender desk, we've been having issues of girls being molested within and outside the campus. And we've been working with the Nairobi Women Hospital to refer the girls and boys for their examination. But now we have a gender-based where all those examinations can be done within a span of less than 24 hours, and we only take a sample to the Gender Recovery Center where it can be examined further. So we'll continue to partner with the Nairobi women, and we are happy for that. The other thing we have developed to the UNESCO under O3+ project is the student safe spaces, which we have also launched this morning. And this student safe spaces is an outdoor gazebo environment where the student can interact with their peers, with their teachers to discuss pertinent issues that affect their lives. And that will go a long way in processing any mental challenges that they may have in the course of their study. And this also will improve the productivity in their classroom. And we've also, with the UNESCO, developed what we call life skills curriculum, which will be launched sometimes in January 2023, where all these issues of reproductive health, the gender-based violence, the issue of career, mentorship, psychosocial support, will be launched by the university to make sure that when the students are not taking the academic programs, they have an opportunity to go to the UN Skills Center, managed by the Dean of Students, for them to be able to learn the life skills, which makes them market and future ready and able to navigate on the challenges they are going through. And finally, but not the least, we are developing an army of what we call peer mentor and the O3+ champions, who will be an immediate source of help for their fellow students. The same way when you need money, there is M-Pesa all around. I hear there are around 18,000 agents of M-Pesa. Anytime you have a money challenge and there is money in the M-Pesa, you can withdraw and transact. We also want, in every 10 students, there is a mentor, a peer mentor, who can reach out to the student and they make sure that they don't suffer with their problem. So with those few remarks, we can say that the University of Nairobi, we are impacting a generation that 30 years from now will say, if it were not for the knowledge that we got from the University of Nairobi, the social knowledge, the academic knowledge, and career knowledge, we wouldn't be who we are today. And that legacy is what we are striving for under our core value and our 6 core values of the University of the UN Cares. Thank you very much, and may God bless you all.
Thank you for that, Mr. Johnson Kinyua, and legacy indeed is what a lot of you have left today. The launch of that gender desk, that is legacy. It's going to help the lives of so many students. So thank you again for setting the tone for how gender-based violence needs to be addressed on campus. I'd now like to invite the Deputy Vice Chancellor of Academics, Professor Julius Ongengo, to make some remarks. Once again, we can welcome him.
Thank you, Janet. Distinguished ladies and gentlemen, all present, good morning. I said good morning. Thank you very much. My name is Julius Ogengo. I'll make some remarks of my own, but I'm also representing the Vice Chancellor, Professor Kiaba, who has sent his very warm regards because he had to be away to attend to another matter, but he has given me a statement to make, and I will read it directly as it is, but I wanted to share some experiences very briefly. In 1989, it was within 5 years of describing HIV/AIDS in this country. I was a young medical officer and I was working in the lakeside city of Kisumu. And there was this 85-year-old man, Mzee. And he had come in very sick. And everybody had done all the tests. Nobody considered that HIV/AIDS was a possibility. As young doctors, we said we'll take a risk and we'll test him. And you will not believe it, he was positive and he had 5 wives. And the youngest wife was in her 30s. Of the wives, she was the only one who was positive. In 1990, we joined another hospital, and there was this 35-year-old priest. And priests, with due respect, Father Kaigwa is here, are known to be holy people. This particular one was also very holy, but he came in unwell with rather unusual presentation. He took a detailed history, and in his practice, he had interacted with very many other people, and he turned out to be HIV positive. He died very rapidly, at a time when HIV was known to take very long, but this one died within a month of diagnosis. Several other people who had been interacting with him also died within a very short time. That experience taught me, in considering HIV, leave no one behind. It affects everybody except those who are clean, and only God is clean. So when we joined the university as young scholars, that time under the pupillage of one former vice chancellor called Joseph Mungai, we started teaching medical students. We sacrificed a core course in human anatomy and began to teach HIV/AIDS as a course, 1 hour every week. But I suppose we were sharing with Professor Gitzel here that when something happens repeatedly, people get so used to it, they think it's normal. So I think we talked about HIV/AIDS so much, and people started to think that it's normal, and it was withdrawn from that curriculum. We have been teaching HIV/AIDS as a common course, and the other day when we suspended, everybody said, you guys were not serious. The university did not suspend the HIV/AIDS program because not important. We suspended it to rethink the manner in which we offer it. And the rethinking is so that we can incorporate it with the other things, alcohol and substance abuse, gender violence, to all come out as a package. Around about 2010, 2011, we did a study on about 12,000 victims of gender violence in Nairobi, in a recovery center, and the champion of that recovery center is here. Dr. Thenya, why don't you just wave, just in case people, yes. Dr. Sam Thenya, not just a friend, there's a history with it, with both medical doctors, and he was running a facility, he still does, where they pay a lot of attention to gender violence. And we did that study, and those of you who are computer savvy, the students in the room, you just put in, just go on, say Ogengo, and say gender violence Nairobi, and you can read that article. And the study was done in a facility that we know very well. And a lot of these things we are describing now that we have done today are directly related to us. They are things we know, and we can relate to them very well. The population that's being described, when I listen to people describing this age group, it touches me, because it seems like you are describing my population. My population of 40,000, I have 40,000 students, plus minus 10%, and the majority of them are in that age group. But like I said, this thing hits everybody except those who are clean, and only God is clean. So we are all involved. Therefore, my colleagues, the matter that we are here to celebrate, to join the world in marking, the matter that we are here to listen to, is a matter that's very close to the heart of the university. And that's why we were all there when we opened the gender desk, we were all marching, and when we heard about safe spaces, we were all there to support that, and we'll be happy to support many more of that. With those, and I did write a little book on HIV/AIDS education for schools, and we can speak after this if you need a copy. With those notes of my own, may I now read the Vice Chancellor's direct remarks. I will read them as written. Your Excellency, Ambassador Ole Thonke, Ambassador of Denmark. Excellency Caroline Vinshine, Ambassador of Sweden. Excellency Professor Hubert Gutsen, Regional Director, UNESCO. And the UN Women Representative, Ms. Anna Mutatvati. Dr. Anastasia Nyalita, a member of the Nairobi County Government Health Reforms, representing the governor. Ms. Lindsay Little, PEPFAR Kenya. Ms. Flora Mwaora, County Commissioner Nairobi. And Ms. Emily Opati, the Deputy Director, GBV, Ministry of Public Service. Invited guests, staff and students of the University of Nairobi, members of the press, ladies and gentlemen. I thank you all for joining us on this very special day when the University of Nairobi joins the rest of the world in commemorating the World AIDS Day. The university has always commemorated in our clear understanding of the threats HIV and AIDS pose to the university community. The university population, comprising mainly young adults, are predisposed to HIV, adolescent pregnancies, and gender-based violence, as they happen to be at a prime age where they start forging relationships in an environment that is away from parental control that they were accustomed to. Needless to say, that the academy has not been spared of this scourge, nor of gender-based violence either. HIV and AIDS is one of the world's most serious public health challenges that we face in the world today. However, there are global efforts to stop new HIV infections and to ensure that those affected have access to HIV care. Are directly and negatively influenced by gender-based violence and early sexual debut that may also culminate in undesired adolescent pregnancies. An estimated 1.5 million individuals worldwide acquired HIV in 2021, where 1.3 were among adults and 160,000 were among children less than 15 years old. Globally, an estimated 38 million people are living with HIV at the end of 2021. It's encouraging to note that in Kenya, the prevalence of HIV has reduced to 4.2%, according to World Health Organization figures of 2021, thanks to the concerted local interventions. This translates to about 1.4 million people living with AIDS. Aggressive HIV testing services have borne fruit, where 95% of the people living with AIDS knowing their status, and of which 89% are on ARVs. At the University of Nairobi and through our HIV prevention program, based in the University Health Services, we have effected deliberate measures to test, prevent, and manage HIV infections. There have been outreach activities geared towards HIV prevention, prevention of early pregnancies, as well as gender-based violence. In partnership and in collaboration with UNESCO, we have developed technological application, the RADA app, to enhance student health and to help health-seeking behavior, and therefore bring them closer to the healthcare providers. The university is currently reviewing its HIV prevention policy to improve service delivery in the area of HIV prevention and management. This truly resonates with this year's World AIDS Day theme, and that is Stop HIV Infections, Adolescent Pregnancies, and Gender-Based Violence, Sawazisha. Finally, today morning, we had the opportunity to launch the Gender-Based Violence Recovery Center at the University of Nairobi Health Services. The resource, which has been established with the support of UNESCO Regional Office and UN Women, will go a long way in supporting the recovery of gender-based violence survivors. It's a great milestone in creating a safe learning environment at the University of Nairobi, and we're indeed grateful. I want to thank all the partners who have come to participate in today's celebration. The University of Nairobi, in partnership with the National Gender Commission, are planning to hold National Gender Conference on Gender Equality and Family Socialization for Human Security and Sustainable Development next year between the 19th and the 11th of May 2023. I extend a warm invitation to you all to partner with us in hosting the conference to create awareness and advocacy for gender equality and empowerment as an urgent developmental issue. Thank you very much, everybody, and God bless you. Signed, Professor Stephen Kiama, Vice Chancellor. Thank you very much, and have a good day.
Thank you very much for those remarks. We are now going to go into a space of the skit, and I'll ask Chris to be on standby. Professor Julius Ogang, thank you so much for those inspiring remarks. As Chris gets the students ready for the skit, just to emphasize the theme, this year's theme, the 2022 global theme is equalize. The hashtag is Sawazisha. So if you want to have the conversation online, you can use that. People can follow it. The national theme is to stop HIV infections, adolescents' pregnancies, sexual and gender-based violence. End triple threat. The hashtag is end triple threat because there is an intersectionality between all of those forms of violence. They go hand in hand, and that's why they've been recognized on this level, and they need to be addressed with the same kind of passion and policy that we're seeing. So end triple threat is the hashtag. Keep the conversation going. Talk about it with your friends and peers after this. I'd now like to invite Chris and his peers to give us a skit. Thank you.
Playback, give us playback. Studio, give us playback, please.
World Cup season, tuanze.
Maria. Lionel Messi. Messi's hit! Oh! That's what they came for!
Yes! Yes! Who are nani? Who is that?
What is wrong with you?
Sadra said!
What is wrong with you?
Sadra
Get
said!
a remote.
Hey! Hatuwezi tulia huku juu una watch football. Huyo ni nani?
Somebody more equipped. Oh, my rust. Yeah. Apparatus are faulty. You are obsolete at this moment.
Hey, vizuri sana. Thank you. Out of my house. Go and live with that functioning object. You're in my house.
No, what is wrong with you?
Daddy, please.
What is wrong with you?
Daddy,
I want a divorce. Come on, Daddy. You are my girl.
He's in my house. You're in my house.
Young lady. Young lady, behave. This is a fact. I am the man here. Unasikia? Wewe. Kana tukumaliziane.
Basta. Nimechoka na mambo ya hii nyumba. Kila time dad and mom are fighting. No one has my time. Do this anymore. I'm so fed up with this house.
Babe, sasa uko wapi? Kwa unalala? Uko wapi? Unalala? Aya, niko na bash, nataka tuende. Ni nini unaongea ni kama unaenda kukufa?
Okay, kindly. I don't think I can talk right now.
Ebu ngoja kwanza nifungulie gate, niko hapa nje.
Ushafika? Okay, give me a few.
Buda wewe unapenda kuchoma. Nini nakwambia nimekupangia mali safi. Hiki tu nimekuletea utapiga bro. Utafurahi.
Mimi sipendi hizi stories zako. Wewe unajua tu level yangu. Mimi si yuko ready uniletea hapa dem bunduki, dem kienyeji. Mazee mizi.
Buda umeona manzi yangu. Si unajua tu karo vile ameiva. Mimi nakwambia nimekuletea mali figa 8 figa ya chupa bro. Imeweza
Sikiza. Mazee unakumbuka niligonga ule dem Nancy last week? Lakini nasikia bana ati yako na ukedi mazee.
Buda wewe una ukedi.
Sikutumia kondiko mse.
Bro hiyo ilikuwa first time. Huwezi pata ukedi na first time. Kwani wewe ni duanzi aje Buda?
Ilikuwa first time.
Hata kama ni kwenda na Sandra unaenda hivyo kondiko na nayo.
Hizi ndo amefika
amefindwa. Unachiki vlami. Babe, uko fiti?
Niko poa.
Mimi niko poa babe.
Ni ule rafiki yako?
Huyu sasa Brayo the guy, Ndio huyo sasa.
Nimekuja acha kuogopa. Nimekuja na beshte yangu. Say smile. Anaitwa Sandra. Huyu ni beshte yangu.
Okay.
Sandra, unamjua? Huyu ni beshte yake anaitwa Brayo. Sasa bibi unakumbuka kulikuwa na place tulikuwa tunachukua zile mzigo before bashi ianze. Sasa sukai na yeye. Mam sukai tunakuja, babes nakuja, sawa? Kana yeye nakuja sasa sawa?
Wewe chunga umanzi sawa?
Wewe nichungie rafiki yangu.
Sandra. Hi. Yeah, Emma ziko fiti. Uko na nywele smart.
Usinishike.
Chill. Sikuli watu.
Social distance ka huko.
Okay, cheki. Kama unamakucha poa mazee.
Wacha kunishika.
Cheki, relax.
Wachana na mimi ala. Daka.
Sasa usikie nilikuwa namwambia. Nilikuwa namwambia Sandra ache kuogopa. Na wameenda wapi?
Mimi nilikwambia mzee wangu ni mzee ako na nguvu bro, anatumia mikutikuti kitu yake anapeleka mbio.
Sandra mmoja amekubali.
Nakwambia ni Brayo wewe. Wewe Brayo ana jokes.
Mbona unalia?
Wewe ni nini demo wako kwa netiti?
Umemfanyia nini?
Mimi nilikuwa na yeye, si tulikuwa na wewe.
Umemwambia mfanyie nini?
Mimi si tumeenda na wewe. Wewe acha ujinga, mimi utanitetesha wewe ni nini? Wewe kama unataka unaweza enda si eti nini? Wewe babe tulia, relax. Nini mbaya na wewe? Wachana na mori wangu, relax babe. Babe twende nini? Relax, tulia.
Nyamaza. Listen.
Unachoma pia wewe.
Nyamaza.
Nyamaza. Nini?
Nikipata umefanyia beshi yangu kitu. You will have to face me.
Babe relax.
Niache.
Na wewe Morio nini nakuletea manzi, wewe kazi yako ni kuchoma. Unadhani nitaitisha form nyingine hivyo? Wewe nini kanyonge huko bro?
Si ukae.
Wewe enda.
Unajifanya mimi nimesikia utamu. I've had good. Nini?
This time of the day mtoto wako hajakuja. See, like mother, like daughter, you just you have inhibited stupidity in her.
Wewe si unaenda unatafuta na wasichana wadogo kama msichana yako? Mimi nimefanya nini? Wewe ndio unaenda kutafuta nao?
Ndio huyu.
Hey, Pleasant Kingston.
Jeuri wepi.
Ndio kufika?
Where have you been?
Ndio dube ya nyumba.
Where have you been?
Natuletea nyama.
Talk, where?
Daddy, I can explain. Okay, please kindly.
Where have you been?
Ulikuwa wapi ongea? Huko.
Huko.
Hivi achana na yaje. Wewe kuja hapa. Unaenda wapi? Kuja hapa. Wewe ulikuwa wapi?
Sasa huyu Mai. Sasa nitaambia nini Sandra? Na hata hii nyumba ni chafu tu. Ni nani? Basi usinivunjie mlango, nakuja. Sasa ni nani?
Baby, ni nini wewe?
It had to be you.
Si ni mimi, kwani ni nani mwingine? Ulikuwa unangoja nani?
Kwangu toka.
Wewe
uniaibishe.
sijakuja na ubaya, nimekuja kukupea riba ingine hapo imetokea nini?
Ufanye nikosane na rafiki yangu, unakuja kwangu.
Sasa usikilize, ni nini za
Unataka
kuja
nini?
tupigane?
Unataka nini?
Relax, keti chini usikize kile nimekuja kusema. Nini ni wewe?
Ongea.
Pia hiyo kierere utaacha, si
Ongea.
eti nini?
Utaniongelesha hivyo hapa ni kwangu bro. Ongea.
Okay, sawa. So, kuko hivi. First of all, nimekuja kuapologize juu.
You better.
Si unyamaze, ni nini wewe pia
Maliza
wewe?
kenye unataka
sikiza.
kusema, mimi sina time yako.
So, Brayo, si unajua Brayo?
Huyu mwenda wazimu mwenye sijui fanya nini beshte yangu.
So, Brayo ako na ukedi.
Ngoja. Brian ako na ukimwi.
Ako na ukedi, nimejua tu saa hii, si eti nini, si ni
and all
blame.
along you knew this.
Sikuwa najua,
All
nimeambiwa
along
hiyo
ulikuwa
riba
unajua,
saa hii, kwani
umefanya
unataka nifanye
nilete
nini?
beshte yangu.
Si nimekuambia ndo uende uonge na yeye. We can solve
Uongeange
this.
nikiongea,
Unajua
sawa?
ukimwi si eti atakufa nayo.
nakuambia nini
Si uende
sasa?
umuongeleshe calm down. Wacha mimi nisake Brayo, alafu wewe uongeleshe Sandra. Nini
toka, nataka
wewe
kwenda
nini?
kutafuta Sandra.
Kani hivyo mimi nitakuacha.
Na
Nini
unanifuata wapi?
nisisikilize?
Shenzi.
The last time you betrayed me. Okay, I really don't want to hear from you. Do you mean? Ngoja. Ati Brian akuna ukimwi. So this is it. This is what you really wanted for me. You mean, what kind of a friend are you? Masa ni sawa inaishu. Now I'm going to face society.
Achana mimi. I will ask for that divorce. Achana mimi. I will ask for that. Achana mimi.
Sandra. Nini my dear? Nini mom?
Mom, nimechoka.
Nini wewe ni mgonjwa?
Mtoto wangu unambukiza ujinga.
Achana mimi. This is your fault and it's your fault. Hakuna mtu kwa hii nyumba ananipea attention when I need it. Kila saa ni kupigana. Kila saa umefanya. I am tired and fed up. You did not teach me how I'm going to face the world. Now I went out there and I was raped. And now I am HIV positive. Are you happy?
Guy, my daughter.
My young
Nani
girl.
amefanya hivyo? Oh my God.
My son Bim.
Sandra, umeenda hospitali? Fanya hivi.
Relax. HIV is not the end. Sawa. Sawa. As long as we are here, we will live. Okay.
Mami yako hapa sawa? Sawa.
We will guide.
Utaenda hospitali, utasaidiwa na madaktari sawa? Hii si mwisho. Sawa?
My young girl, relax.
Pole.
Relax.
Sorry my dear. Pole baby.
my love to you is like without I deny.
Okay, all right, all right. So what do you need me to do so that you can believe me?
I do not need you to tell me. I deny. Mercy,
Please,
I deny.
Listen. Please, I beg you.
Okay.
You're the only person who can listen to me.
How many
I have
persons
no
are
one
in your
else.
life?
I have no one else.
But who affected you? You have so many persons in your life, Mercy.
But you know very well that I'm a virgin. I don't just go out sleeping with just anyone.
So did you drink HIV to your blood? Mercy, I deny.
So Dennis, you're doing this to me too.
I deny.
Right now, but think about it. What if it was your daughter? What if it was sister or your aunt or your cousin? Stigmatization. That has become a thorn in our flesh. Mercy sat there. Mercy was looking at her life. Mercy was thinking, but who will be merciful to her? Who would listen to this dissertation of Mercy? Because many of you in this audience will ask, where did Mercy get HIV and AIDS? Because to me, Mercy is still a virgin. Virgin like the river. We say virgin like Port Florence. But where did she get this HIV and AIDS? Suffer.
Mother, please, Mother, come back to life. You're the only person who could understand what we are going through. Now I have no family. My brother is out there hustling. Dad just chased me away. My boyfriend too. Mother, I have no one. Out there, everyone doesn't want to walk with me. You promised when you left that everything was going to be okay. Is this what you meant by okay? Is this what you left us with? At this point, I have no one. Absolutely no one. That day when I chose to go with my friends for a test, I was so happy. I knew very well that, you can never be positive. It is not, oh God.
I know many of you are wondering why I'm this sad. Why I'm this bitter with this story and this decision. Because I stand here a sad man and a man. Because that is my sister. And it pained me to discover that we contract HIV and AIDS during birth. But is there awareness about that? Is there awareness about ways that people can contract HIV and AIDS apart from sexual intercourse? I ask to the audience, do you know about those things? And if you don't know, then I invite you to go to RADA. Visit that app that it will tell you the different ways. Na kama uko RADA basi mimi niko RADA, na kama uko shua mimi niko shua. Na niko shua that natembea na shua saizi, kama una shua basi kuja unione, nitakuwa shua that tutakuwa shua. I want all of you to rise up. I want all of you to rise up as we remember those people that are being affected by stigmatization. I want you to rise up as remember those people that are affected by gender-based violence. Let us all rise. Tafadhali. Tafadhali, let us all rise. This is a story of an insane man. I hope mmesikia story because that is my story. And her name was not Mercy. But Mercy, I gave her that name because I wanted to have mercy on such people. But her name is Rebecca. Rebecca, basi band mnasemaje? Thank you very much. That has been our town here. Asanteni sana. Thank you very much.
Right, thank you, thank you. You may take your seats. Thank you for those skits and for that performance. And I know we were laughing and we were engaging, but let's be honest, it's really, really triggering as well, right? That's how real gender-based violence is. That's what it looks like, and it's painful to watch. It's a reality for 1 in 3 women. Make no mistake, gender-based violence affects everyone, but 1 in 3 women is affected by it. There are different screenings happening today on campus. Free health screening at the Great Court main campus. These include HIV testing. We just saw that. We just saw that being dramatized, and again, everything you saw is a real-life situation. That is storytelling, one of the most powerful tools that we can use in addressing these issues. There's HIV testing, cervical and breast cancer testing as well, COVID vaccines on site, mental health assessment. Like I said, these are very, very triggering subjects. Let's not invalidate the trauma that it leaves in our minds. So please try and find a way to have a mental health assessment. If you're triggered by this, you or someone you know, take your friend with you. And there's also health talks, general health talks. And some of them are quite personal. You can find a private space to have these health talks. They're available till 4 p.m. today on campus for free. I really hope that each and every one of you can take advantage of that. I know that there's millions of young people that wish they could, that don't have access to these. So please make sure that we don't have more situations like what we just saw play out in front of us, because that's the reality we're trying to fight and end. The storytelling gives us a window into how deeply disturbing these issues are. They are real. A lot of us who work in this space, on this podium, in the front row here, deal with these issues every day. It's hard, dealing with survivors, dealing with people and trying to get them to understand their HIV status. You can actually switch and pivot your life today. So please make sure you take advantage of the free testing. We're going to get into a few remarks before we recognize the Mount Kenya climbers, but before that, I'd like to bring on stage, just to speak briefly, Dr. Sam Thenya, who is the CEO of the Gender Violence Recovery Center, somebody I spent quite a bit of time interviewing when we were on screen. Alberta is there as well, I can see her. So he's just gonna give a few remarks, and then we will go to our keynote speakers who are on stage. So let's welcome him.
Thank you, Janet. The Deputy Vice Chancellor, Professor Ogengo, my teacher and colleague, distinguished guests, all protocols observed, good morning. It's very difficult to speak after such a powerful message from the skits, but allow me to make a couple of remarks. As you've been told, my name is Dr. Sam Thenya. I'm an obstetrician gynecologist by training. I trained both undergraduate and postgraduate at this university, and I'm a great supporter of this university. I founded the Nairobi Women's Hospital and the Gender Violence Recovery Center 21 years ago, soon after I finished my master's degree at the University of Nairobi. And I think this is what Janet was saying earlier. As we sit there as students, the challenge is what space are you taking? And the little that each one of us can do, eventually you never know where it lands, and you never know how much difference you can make. The Gender Violence Recovery Center of the Nairobi Women's Hospital, so far, since inception, directly through our 9 hospitals, we've provided free services to more than 55,000 survivors of sexual and gender-based violence. And through our other partners, more than 180,000 survivors through emergency response. And as you heard from Professor Ogengo earlier, and speaking to the students and the faculty of the University of Nairobi, I think, and I can confidently say, we probably have the richest data in this country on GBV if you'd ever want to come and do any studies. And you heard that we were able to do a study with Professor Ogengo involving about 11,000, 12,000 survivors of GBV. Let me shock you, ladies and gentlemen, that the youngest survivor we have attended at the center was just 3 days old. And the oldest survivor was 105 years old. This year alone, so far since January, we've attended more than 3,221 survivors. 38% aged between 10 years and 19 years, and 26% aged between 20 and 29 years. And this is a gap, and this is where most of our students fall. And when I look at the Generational Equity Forum commitments to scale up services and comprehensive services for survivors of GBV, and also to prevent, I must say that I'm greatly honored, Professor Vice Chancellor and Deputy Vice Chancellor, to witness this occasion and this initiative by the University of Nairobi in establishing the first GBV center in an institution of higher learning. With the support of UN Women and Danida, I would like to make a commitment here that GVRC will provide you with a psychologist and continuous technical support for this center to not only enhance knowledge skills and address secondary trauma, but will also help you bridge that gap to access justice for those who may fall victims of GBV. Thank you very much, and God bless you.
Thank you, Dr. Danya. Once again, more disturbing statistics to sit on. Let's reflect a lot today. I'd now like to invite our keynote speakers to make some remarks, starting with Ms. Anna Mutavati, UN Women representative, who's a huge partner in this work as well. Let's give her a warm round of applause.
Thank you very much, Director of Ceremonies. Let me recognize the presence of national government officials that have joined us today, county government officials that are also with us, our partners from the foreign missions, my colleagues from the UN system, our development partners who are with us today, our hosts, the university, leaders and students, members of the media, friends, allies, and all protocols observed. So good morning. It's still morning, right? Good morning. So it is a great pleasure for me to join you today as we commemorate the World AIDS Day and the launch of the GBV desk at the University of Nairobi. It is significant to note that the gender desk, the GBV response unit, is being launched and commissioned today, 1st December, a day that marks World AIDS Day, and also during the 16 days of activism against gender-based violence. So I'm sure you have heard already how these two agendas are connected, right? Gender-based violence and HIV. And why World AIDS Day is commemorated within the 16 days, because those two go together like this, or they are in the same WhatsApp group. I think that's the language you understand, right? Yes. The World AIDS Day, which is what we commemorate today, is a day where we unite and we are reminded that HIV is still among us. So I know that many times we are tempted to think, you know, oh, it ravaged in the 1980s, sorry, 1990s and early 2000s, but no, the fact that we commemorate it every year is a reminder that this scourge is still amongst us, and that we need to all do our part, double our efforts to ensure that there is prevention, that we don't get more new infections coming up, and that we continue to support those that are living with the virus. The 16 days of activism is a campaign that starts every year on 25th of November, and it ends on the 10th of December every year, which is also the Human Rights Day. The 2022 World AIDS Day global theme is Equalize. And Kenya has adopted the theme, you forgive me here, I'll try my best. The theme for Kenya is Sawazisha and the triple threat. And it is a prompt call for collective action to end new infections of HIV, and also end sexual and gender-based violence, and end adolescent pregnancies that perpetuate inequalities among adolescents and young people. Globally, we are told that 47 million girls will not be able to go back to school because they got pregnant during COVID-19. So I'm just sharing a few statistics globally to connect the issue of teenage pregnancy, HIV, gender-based violence, and how those are all factors that we need to address as we seek to end gender-based violence and HIV in Kenya, but also globally. So we know the data is also not good for Kenya. We know that we have counties that have hundreds of thousands of teenage pregnancies every year, and we know where all those young girls end up. They end up in child marriage, they end up giving birth to children when they are still children themselves. We know that they are pulled out of school. We know that they are trapped in cycles, intergenerational cycles of poverty. We know that the outcomes of life for that woman, that young woman, she will pass on poverty and more poverty to her children and the children after the generation and generation. So that's why it's very important that we break those cycles and ensure that girls stay in school, that we get rid of teenage pregnancies, that we get rid of HIV and new infections of HIV, especially among young people and especially among young women where it has really taken a life of its own. Ladies and gentlemen, Kenya is a very young population with more than 1/3 between the ages of 15 and 24. Whilst young people play a crucial role for Kenya's social and economic development, young women also face high risk of HIV infection. They face high risk of teenage pregnancy and gender-based violence. In fact, I think in some quarters they are already saying HIV in Kenya has taken on a young female face. So I think that's most of us here, right? We are young, we are female, and so do we want to keep that face of HIV, or we also want to say today as we mark the World AIDS Day that that stops with us, that stops with me. I'm not going to, perpetuate this cycle. So I think it's a challenge that we all have to carry, and then we have to run with beyond the World AIDS Day. So let's make every day World AIDS Day, where we are all recommitting to ending new infections among young people, and especially among young women. In terms of gender gaps, there are also gender gaps in how men and women access HIV services. So the center that's been set up today is not just for women. So we encourage also young men. I'm a mother of 2 young men, and if I were in this environment, I would also encourage them to be frequent users of those services so that they get to know a lot more about their own health and how to prevent and how to keep themselves, but also the women in their lives safe. So in terms of gender gaps, we have seen that harmful masculinities are discouraging men from testing and seeking care. So let me just find out from the young men in their house, right? So how many of us commit today that they will, smash these harmful masculinities? I think you know what we mean by harmful masculinity. You know that what it means to be a real man. How can a real man be seen going into a center like that, right? We understand how harmful masculinities work, right? That those things are for women. As men, we have to tough it out. And as men, we take risks with our lives, right? And we don't use protection. As men, we want to have as many sexual partners as possible, so we get the sex experience before we commit, and so on. So all of those are harmful masculinities, because they teach us to take unnecessary risks with our lives, right? So again, with those harmful masculinities, I want to just find out today how many of us do commit that they will smash the harmful masculinities that they've been socialized to adopt as part of our life. Can you just show me by a show of hands? You have a lot of work to do here, our partners. How come the young men over there, you want to hang on to your harmful masculinities, harmful values of what it means to be a man? Can I see a recommitment again? Okay, so kidogo, yeah. There is a bit of commitment, but we need to do more so that we revisit those values that we were taught growing up, that's what it means to be a real man, because it's leaving us in danger, right? And we are necessarily exposing ourselves. So we've seen that while 80% of women who are living with HIV accessed treatment in 2021, only 70% of men were on treatment. Distinguished guests, ladies and gentlemen, gender-based violence has been identified as a significant driver of HIV infections in women in the region, globally, but also in our country here in Kenya. In the last decade, women have become the face of HIV and AIDS in sub-Saharan Africa, with 61% of people living with the virus in the region being female. So just pause a bit, 61% of all people who are living with the virus in Africa or in sub-Saharan Africa are women, right? So that's why we conclude that HIV is now taking, or has taken on, a young female face. In Kenya, we are not doing any better. While the national averages are low, we know that there are counties that have very high incidence of HIV new infections. So it is, data says that Nairobi, Kisumu, Siaya, Homa Bay, Migori are among some of the counties with prevalence that's higher than the national average. So it's not to say then that if you are not in those counties, then you relax and say, okay, as we are good, we'll continue. No, it just means the risk is higher there, but the risk is still everywhere, including in some of the counties that we have not mentioned here. So gender-based violence is highly also prevalent. So remember, I'm talking about HIV, I'm also talking about GBV, because the two belong in the same WhatsApp group, right? Gender-based violence is highly prevalent in Kenya, with more than half of the women disclosing that they've been subjected to sexual harassment since the age of 15. Therefore, there is an urgent need to increase gender programs that transform our norms, our attitudes, and our practices so that we join hands to end gender-based violence and HIV. Ladies and gentlemen, let me focus a bit on one specific form of violence or gender-based violence, which is violence that's experienced in institutions of higher learning and in public spaces. The unfortunate reality remains that women and girls are not safe in institutions of higher learning. When they are walking on the streets, they are not safe. When they are on campus like this, they are not safe. When they are selling their goods, they are not safe. When they are shopping in the marketplace, they are not safe. When they are commuting on public transport, they are also not safe. Or when they are simply using community or public toilets, they are also not safe. So and then also in the homes, they are not safe. So where are women going to be safe? So the insecurity, this insecurity that women experience has a massive impact on their lives. Both the threat and the experience of violence affect their access to social services, affects also their performance in school, affects their access to health care, and affects how they perform or participate in developing the economy of the country. We also know, and you have told us, I don't know why I'm even telling you this, because you told us that when you experience these forms of GBV, it results in you having low performance in school, it results in you slowing down your productivity, it hampers your career development, it lowers the quality of your work environment, and so on. So if we are all agreed that this needs to end, it means that the other part that needs to play, the other half of us that need to play a part in ending, and this is the men, right? We need to all commit together to ensure that we create safe spaces for everyone, women and men, young women, young men, to thrive as they pursue their lives on campus. The creation of a GBV desk at the University of Nairobi aims at creating more awareness on sexual harassment and sexual and gender-based violence within the campus. It will also help in identifying and recognizing abuse and assist survivors. We don't talk about them as victims, we talk about them as survivors, including access to justice. The desk will also help the students and staff to stand up for what they believe in and have a voice against sexual gender-based violence. So as I'm ending, I want to leave our commitment as UN Women and with our partners. We will continue and we commit to promote an institutional culture that supports safe public spaces for women and girls as they pursue their education. So we'll continue to work with the University of Nairobi and with our partners, GVRC, ActionAid, and UNESCO, and the Ministry of Gender, and so on, so that we create a safe space for all the students on campus, and that you can be facilitated to enjoy student life, because I think it was the best time of my life, and so no one should be deprived of that right, but also for you to just become whoever and whatever you want to become in life without fear of being violated. So as I'm leaving the stage, I know I've spoken for too long, I also want to leave a challenge with you. How are you going to make your community safer for women? How are you going to make where you come from in your own family, within your campus here at the individual level, and within Kenya? Will you stand by when a woman is being abused and you say that's a personal thing or a private affair? Will you be a bystander, or you will stand by, take action and denounce that violence wherever you see it occurring? So I hope that I've left enough challenge with you today, and I thank you for listening to me for so long, and I wish you all the best as we commemorate the 16 days and as we mark the World AIDS Day today. Asanteni sana.
Thank you so much for that, Ms. Anne Mutabati, leaving us a lot to think about. Can we all say out loud, it starts with me? Louder, it starts with me. Because when you start to normalize and internalize that, you begin to take the small actions towards the challenge that Ms. Mutabati left. What are you going to do? It starts with you. So thank you for those remarks. I'd now like to welcome Professor Hubert Geisen, the Regional Director of UNESCO, to give a few remarks, and later on again a reminder that we'll be recognizing some of our hikers. So, Professor, welcome.
So, dear colleagues, keynote speakers here on the podium, I was looking at this panel, and I always instruct my teams, when we have a panel, you must ensure gender balance. And I was looking at the panel, and I was happy that we didn't manage today. Representatives of embassies, diplomatic missions, UN colleagues, senior government officials, members of academia. Most importantly, let me say welcome to all the young students present here. I enjoyed your performances. I would say, wow, what a talent you got here in the University of Nairobi. Ladies and gentlemen, mabibi na mabwana, a very good morning to all. Habari za asubuhi. Ni vizuri kuwaona nyote. Karibu, karibu sana. Nina furaha kubwa kujumuika nanyi leo katika hafla ya siku ya ukimwi duniani na kujiunga na uzinduzi wa dawati la jinsia lilioanzishwa na chuo kikuu cha Nairobi kwa ushirikiano na UNESCO na UN Women pamoja. Samahani, Kiswahili yangu ni mbovu kidogo. Lakini nitaendelea kwa Kiingereza sasa. So I would like to congratulate the University of Nairobi for being among the first, one of the first. I can't be sure there isn't another one, but I haven't seen one. So one of the first higher and tertiary education institutions in Kenya, and in fact in the wider region, to establish a gender desk to promote gender equality, including eradicating gender-based violence in university institutions. And I also thank the University of Nairobi for hosting us today, for hosting this important event, and for the strong partnership that we have in the implementation of the UNESCO O3 program. And I will say a few words about the O3 program in a minute. But this partnership in the O3 between UNESCO and the University of Nairobi is a very powerful one, and it is rolled out over all the 10 campuses of the university countrywide. Now, the UNESCO program O3 in full, what do these 3 O's stand for? It is our rights, our lives, our future. So it is about young people. It is implemented in 33 countries in sub-Saharan Africa. And it is aimed to support country efforts towards the attainment of impact level results for adolescents. And of course young people in 4 main areas. Let me just briefly mention them. First, the reduction in the number of new HIV infections. Second, reduced rates of early and unintended pregnancies. The eradication of gender-based violence and the eradication of child marriage. Now the O3 Plus builds on the current O3 program to focus on young people in higher and tertiary education institutions in 4 countries, and that is here in Kenya, in Tanzania, in Zambia, and in Zimbabwe. Now we are planning at the moment to expand this program to other countries in the region. Thanks to the general support of the governments of Sweden, France, Switzerland, Norway, Ireland, and also the Packard Foundation, these programs align with the current efforts by UNESCO to address the intersections of 3 SDGs, SDG 4 on education, SDG 3 on health, and SDG 5 on gender equality. And that is to contribute to a sustainable future for Africa's children and young people. Mabibi na mabwana, with 60% of the population in Africa being under 25 years, we see a rapid growth in university enrollment numbers in the entire continent. Most of the new students will, for the first time, live on their own without the daily guidance from parents or guardians. The students in higher education institutions, therefore, may face a range of challenges that include, amongst others, bullying, gender-based violence, exposure to health risks such as drugs abuse, HIV and other infectious disease, early and unintended pregnancies, but also mental health issues, and that happens as they assume new responsibilities, new relationships and experiences on their own and in unfamiliar settings. Now these issues, they can negatively affect the academic and social lives of students. They can also affect the career progression and attainment of their life goals, ultimately limiting the realization of their potentials. Ladies and gentlemen, on this World AIDS Day, let us recognize that the highest number of new HIV infections here in Africa happen in the age group 15 to 24. Now at the same time, this is an age group who often don't realize that they are at risk of HIV, and often they don't get tested. And therefore, I can't say this loud enough. When it comes to HIV, in the absence of a cure, education is the only vaccine available. Working closely with relevant ministries, national and regional structures, university, and key partners, UNESCO continues to support university students in access to life skills-based, culturally appropriate sexuality education and sexual and reproductive health services. We also advocate for policy and practice changes to make campuses safer for students, make them more inclusive and supportive of learning and teaching for all students and staff. One of the innovative approaches that UNESCO has supported is the development of the RADA app, the RADA mobile app, which was developed by and for the University of Nairobi students, and it was meant to enhance access to sexual and reproductive information and services. As part of UNESCO's support to the University of Nairobi in establishing the Gender Desk in collaboration with UN Women, we have also supported capacity building for 122 healthcare providers on youth-responsive services. In addition, we have trained 80 security personnel on how to respond to violence-related issues among students. To promote health and well-being, UNESCO has undertaken health and well-being awareness campaigns in the 10 campuses countrywide, the 10 campuses of the University of Nairobi, and there students could access testing for HIV and cervical cancer. Mabibi na mabwana, today we are commemorating World AIDS Day as we focus on our attention on the inequalities that drive HIV and AIDS. The epidemic has been around for almost 4 decades, and with important milestones achieved globally on prevention and on treatment, it may be possible to end the epidemic by 2030, and that's the target under SDG 3. In this regard, I'm very pleased to inform you that one of the O3 Plus objectives indeed is to eliminate new HIV infections among learners in the participating institutions. As I conclude, ladies and gentlemen, I would like to thank all the partners for their support to this program, And I also wish to reiterate the commitment from our side, from UNESCO, in collaborating with you, with all of you here, and with the University of Nairobi, and also with other institutions of higher and tertiary education to promote safe, inclusive, and gender equitable learning environments for positive educational and social outcomes among young people, and this all through the O3 program. Please join us to make that happen. Asanteni sana.
Asante sana, Professor Hubert Geisen, for also touching on the RADA app and O3 Plus, which has been such an inspiring program for a lot of the young people in the room today. And you saw what the RADA app is about in one of the skits. So please, if you're on campus and you haven't already, try and locate it on your phone so that you can begin to engage with it. It has a lot of resources and access to information. I'd now like to invite Ms. Agnes Ndungo from PEPFAR to make a few remarks. Karibu.
Thank you, Janet. As you've all been told, my name is Agnes Ndongo, and I'm here representing my boss, who was unable to make it today. I'm really glad to be here and to be back to this university. I think let's clap for the University of Nairobi. I think it's the best university in Kenya, don't you think? And why am I saying this? I'm also an alumni. It's a very hard word, of this very university. I did my master's right here at the Gender and Development Studies, as a mother, as a wife, as a worker, and most of all, as a community leader. Why don't you clap for me? So I want to tell all the young people here that it's possible, very, very possible to multitask, and they say women are very good at multitasking. Let's clap for all the women in the room. So today marks the 39th year that we are commemorating the World AIDS Day around the world, as we reaffirm our collective commitment to the global fight against HIV/AIDS. We remember the 39 million people who have died of AIDS worldwide since the start of the pandemic. Through the US President's Emergency Plan for AIDS Relief, PEPFAR, and I'm hoping you all know the meaning of the acronym PEPFAR, the United States has invested more than 100 billion globally, that's billion US dollars globally, and more than 8 billion Kenya shillings to the HIV/AIDS response. We are proud of the tremendous progress we have made working in concert with the government of Kenya, where we now have about 1.3 million people living with HIV. That's a really huge number. And these are living with HIV on treatment, have reduced transmission rates, and have worked to build better health systems. The result is we are on the verge of epidemic control. So the United States remains dedicated to ending HIV/AIDS as a public health threat here in Kenya and around the world. In support of this effort, PEPFAR will continue to work to address health disparities among communities that are to be left behind and have been disproportionately affected by multiple pandemics. Ahead of its 20th anniversary coming in 2023, PEPFAR is reinvigorating the US global HIV/AIDS response in countries such as Kenya to achieve the shared vision of ending the HIV/AIDS pandemic by 2030, while also sustainably strengthening public health systems So PEPFAR's new released 5-year strategy that's fulfilling America's promise to end the HIV/AIDS pandemic by 2030, we focus on collaboration, partnerships to confront the challenge of fighting HIV/AIDS as a security threat in the wake of other emerging health threats. We, of course, still have work to do. The progress we have made towards epidemic control can be readily reversed without focused, sustained, and equitable action focused on both maintaining the gains made against HIV/AIDS and protecting against emerging infectious diseases threats. So PEPFAR will continue to provide support to ensure that people of all ages, and most of my panelists here have touched on the young people in the room, so PEPFAR will support to ensure that people of all ages, genders, and population groups have equitable access to life-saving HIV prevention and treatment services. Equally important, PEPFAR also supports enabling policies and systems and capabilities countries need to deliver effective, efficient, and sustainable health care, including the HIV, even in times of great public health adversities. So PEPFAR investments in Kenya have supported HIV services at more than 2,800 facilities and community health clinics and labs. We will continue to collaborate with partner governments and communities to support enabling environments to erase barriers to quality HIV service access. The greatest asset in our global health toolkit and the greatest public health response is PEPFAR. However, after nearly 20 years of progress, our work is not finished yet. Together, we can confront the challenges before us with conviction and compassion and end HIV pandemic everywhere. So it's possible, it's doable. Under the new PEPFAR strategy, we are setting a bold goal of achieving sustained HIV impact everywhere that we work around the world and creating a healthier, safer, and more secure world for us all. So the PEPFAR, I'm sure you're asking yourself, what are these strategies? The PEPFAR strategies include the following 5 strategic pillars. Very quickly, I'll read them. So one is health equity for priority populations. The other one is sustaining the response, public health systems and security, transformative partnerships, and again, we have follow the science. This is investing in the scale-up of cutting-edge behavioral and implementation science to bend the curve on new infections. And of course, we have the enablers, the community leadership. That's the need to promote sustained leadership, including women and key populations in all elements of PEPFAR's priority setting. Then we have the innovation. The status quo is not enough to get us through the last mile. We need to deploy creative and innovative solutions at scale for the remarkable challenges ahead. And finally, we lead with data. PEPFAR is very, very passionate about data, and today I had a lot of data being mentioned here. So data will continue to drive decision making, and we will support strong country-led data systems. So in closing, I want to close by expressing my sincere appreciation to the Kenya government for its leadership and progress in the HIV response, and a special thanks to all the health workers serving throughout Kenya. I would like to recognize the commitment, leadership, and excellent work and continued coordination and partnership amongst the Ministry of Finance, the civil society organizations, the UN family, Global Fund, and the multilateral colleagues, PEPFAR implementing partners, and I'm sure here in the University of Nairobi, we do have implementing partners that we support and other government allies. Thank you again for the chance to join you this morning, and I wish that you have a fruitful day. And also I want to congratulate most heartily the university for launching the gender desk, and it's my hope that you can each, all of us, utilize this desk. Kudos to the university, good job. And as I said earlier, this is the best university ever, so continue doing the good work that you're doing. And as Agnes, I work as a grants manager at the US Embassy. And what I do with the grants is that I deal with women who have been affected or infected by HIV and AIDS. It's a hard job. So what we do is we gather these groups of women. They apply for proposals or for grants with us, and we do support them, to have meaningful life and to, upgrade their, their ways of living, their livelihoods. It's a sad job, but at the end of the day, when you see the impact that you have made to those communities of groups of women who take care of vulnerable children, it makes, your life, you're kind of satisfied at what you have done, and I think it's a good thing. So I'm urging the young ladies in this room, there is always a choice that you can make. You can stop this, spread, and there is an age group that really is very, very, very vulnerable, and most of us are in this room. So let's stop this scourge, and let's have a choice of stopping this HIV and AIDS. So thank you very much, and please do have a pleasant day, and yeah, we can do it. Like the NCBA logo, we got this. That's what I see them, advertising on TV. We got this, we can do it, yes, we can. Thank you very much.
Thank you. Yes, we can definitely do this. We can definitely make progress. In a few moments, we'll be recognizing the 13 or so champions who hiked Mount Kenya for their rights, their lives, and their future. That's just in a few moments, so I'll just ask them to be on standby. Before then, though, I'd like to invite Kibe Ranji from the National Syndemic Diseases Control Council to come on stage and make a few remarks.
Thank you, Deputy Vice Chancellor. All protocols observed. As have been identified, I'm Kibe Raji from the National Syndemic Diseases Control Council, what used to be known as National AIDS Control Council. So we expanded the mandate, and now we are the Syndemic Diseases Control Council. For purposes of time, please allow me not to use more than 2 minutes of your time. And in those 2 minutes, please also allow me to say 4 points. Point number 1, as a country, as a government, we have done well. Truth be told, we have done well in the fight against HIV and AIDS, and especially among the general population, because we have been able to reduce our prevalence. Last year it was 4.0%. It has been a lot of work. It's quite a journey, and we have been able to do something in the general population. Unfortunately, in that population, we have an issue with some pockets, some cohorts in the population, and especially our young people. Last year, unfortunately, for the first time after a very long time, the new infections rose by 7.3%. Instead of coming down, it recorded an increase of 7.3%. That increase, which is now what is disturbing us as a country, is in a cohort of the youth who belong and who constitute our future. So we need to take care of our future today, or else we shall all one day regret why we didn't have to do what we needed to do. So as young people, that's a challenge we are throwing to you, to everyone. We have an issue, and we need to tackle that issue head on. Point number two, I hope you would forget that our infections are rising for the first time and we need to come together again, back to the basics. 67 of those new infections are among the female population. Our young girls, our young women, we still need to pull up our socks. Unfortunately, though not fortunate, the deaths which have been recorded, 53% of our deaths were recorded among men. Infections are very high among women and our young girls, but when it comes to deaths, 53% was recorded among men. So even as students, that's a good research topic. You can find out why men fear, and you have been told about masculinity here, why we fear to go and get to know our outcomes on health, because we are the ones constituting the highest number among the recorded deaths. Point number 3, so that I finish my 2 minutes. It's on the violence that is being mitigated among our young girls. Here in Nairobi, for example, 1 in every 2 cases of SGBV that were recorded in our systems were people aged 10 to 17 years. Our young girls, our young children are being molested, and the system is telling us 1 in every 2, that is 50%, was 10 to 17 years. So even as parents, as potential parents, just get to know how to take care of your kids out there. It is not that easy. And as a government, we have said we shall now have to be stricter on the Children's Act so that the perpetrators, there is no room for negotiations. My last point, we are headed to Christmas. We are headed to that period. Schools are out for 2 months. Festivities are here with us. Please take care. Remember, when it comes to HIV, we are still, our mantra has never changed. Please, nobody has ever died for abstaining from having sex. Please abstain if you can. If you are in a relationship with someone, you know their status, HIV status, please be faithful. If you are a relationship is neither here nor there, please use a condom. Weka condom kwa mpango. Don't be the figures we are talking about. Protect your life. And with that, I wish you happy holidays in the name of the Father, the Son, and the Holy Spirit.
Thank you for that. Straight shooting, just keeping it full on, and that's also very important. Very, very important. People like Kiberanji, I think, should be the ones in the tents and screenings that we're having, because I think there just needs to be a lot of very real conversations about why the numbers are rising. So thank you for being honest about that, and I hope you heard that wise counsel about the holidays coming in. Our final keynote speaker is Dr. Anastasia Nyalita, who is representing Nairobi County. She's going to give us a few remarks. Thank you. Let's give her a round of applause.
Thank you very much. My name is, sorry. So the Vice Chancellor, represented by Professor Ogengo, once upon a time as a student at the University of Nairobi. Again, I want to confirm, but to be fair, of course, to all the other universities, Nairobi was at the time the only university that was offering some degree courses here. So about 28 years ago, I graduated the Bachelor of Pharmacy from the University of Nairobi. 18 years ago, December, I graduated, and it was December 4th, I graduated the Master of Business Administration from the University of Nairobi. I'm still waiting to start my PhD. So, ladies and gentlemen, my name is Dr. Anastasia Nyalita. Currently in the task force that was appointed by His Excellency, the Governor of Nairobi, Governor Sakaja, to look at, health transformation in the county. Subsequently, also waiting to be confirmed as the nominee for the county executive member representing health, wellness, and nutrition. So we're looking forward to taking these discussions forward. Also, we had a side chat with the prof there from UNESCO, and he forgot to say that he had made a commitment that he will launch a he for she program to enforce what we are talking about today. So with those few remarks, I would like to go ahead and make the remarks from His Excellency the Governor as provided to me, and also pass his regards. You'd have loved to be here, but due to other prior arrangements, he was unable to make it. So the Vice Chancellor, University of Nairobi, Professor Stephen Kiama, represented by Professor Ogengo, all county and national government officials, distinguished guests, ladies and gentlemen. Our chief guest on behalf of the Nairobi City County Government Health Services, we thank you for joining us today and accepting to grace this year's commemoration of World AIDS Day. Your presence here today demonstrates your commitment and dedication not only ending AIDS as a public health threat in Kenya by 2030, but also to eliminating all the forms of stigma and discrimination in the provision of health services. Ladies and gentlemen, this year's global theme, Equalize, is a call to end inequalities that have slowed down the progress in the HIV response worldwide. In Nairobi City County, the call to end new HIV infections, pregnancies, and sexual and gender-based violence among adolescents, dubbed the triple threat, is key to equalize our society. Such challenges reinforce that the HIV epidemic, in addition to other endemic diseases such as sexually transmitted infections and tuberculosis. As we join other counties to commemorate this year's World AIDS Day, we are reminded of other global challenges such as the ongoing drought and COVID-19 that we must tackle with equal lens. Ladies and gentlemen, Equalize is about embracing persistence, resilience, and empathy for others. In the HIV response, we have witnessed the power of transformational leadership that has led to a scientific breakthrough, global solidarity, and generosity to expand access to services for all. We acknowledge all our partners for the successes we have seen in the HIV response across the globe. We commit to the 95, 95, 95 targets of ensuring that 95% achievement of on knowledge of HIV and access to treatment and viral suppression. We have attained impressive results so far in Nairobi City County, and as at September 2022, we had achieved 172,913, which is 104% versus our target of 165,904 for Kenyans living with HIV against the targets estimated at this year estimates was what we estimated for 2021. So we overachieved the targets. So we're saying that at least we achieved more than 100. We achieved 104% versus our target of Kenyans who are aware of their HIV status. And of those who know their status, 172,848, which is 99.96% are on HIV treatment, and 95% of those on treatment have achieved viral suppression. Of course, we need to interrogate the data more. We need to probably look at, are we really gone in, is this data aggressive enough? So that we are looking at a situation where we're actually achieving or exceeding the expectation in terms of our targets. We call upon all of you to join us to sustain the targets within the next or going forward. We can end stigma and allow those scared of accessing services to do so without fear of discrimination. Let us equalize to save lives and end new HIV infections in the Nairobi City County. I take this opportunity to wish you an early happy Christmas wishes and prosperity in the year 2023. God bless you. Thank you. And this is read by myself on behalf of His Excellency, the Governor of Nairobi City Council. Thank you very much, and do have a lovely afternoon.
Thank you so much for that, for those remarks, Dr. Anastasia Nyalita. So a few months ago, first of all, I love the agency that students have. Through this O3+ campaign, we've done Instagram Lives, we've hosted sessions right here at the university, and the agency that students have continues to blow my mind. Please never lose it. By agency, I mean the ability to just speak your truth to power. And before all those conversations started, there was a hike to Mount Kenya, which I promise you I did not make. But you know, those are my goals one day, but I didn't even make it to Satima. But there's a group of students here who we're about to recognize, and also the trainers and some of the members of UNESCO. To tell us a little bit about that, let's welcome Jane Kamau from UNESCO, and then we'll have the students recognized. Let's give her a round of applause, because she made it to the top of Mount Kenya.
Thank you, Janet, the chief guest, all protocols observed. I'm here to read just a short statement on behalf of my regional director, Professor Hubert. But before I do that, DVC, I think today is a day of confession. Everybody who has come here from Dr. Kenya have confessed of their experience when they were students in this university, including our friend from PEPFAR. I'm also an alumni of University of Nairobi. I did my master's and my undergraduate. But I also want to confess that as I sat down, I reflected on the O3+ project, and as the VC said in the morning, for all those years I was here, I never knew there was a dean's office, so I did not go to the dean's office for any support. There was no health program, so as we navigated, when I was doing my master's, I did my master's in 2 years, but I left the University of Nairobi with 3 degrees. Because in the 2 years I was doing my master's, I also got my 2 children. And you see now, maybe as I sat there, I was wondering, if the project was there, would I have become a mother while I was a student? And where we launched today the safe space for students, there is a bench that is not very far from there. We used to call it Pregnant Square, and that's where we used to sit. So I hope that any other student who becomes pregnant, now we hope they don't, but at least they have a space where they can sit. So that's my confession. Now let me read the statement before we recognize the students who went to Mount Kenya, and I can assure you that it was not an easy task. I was among the people who went with them. It's a hike for your life. You reach a point you wonder why you even signed up to go there, but for their determination for the rights and the lives, and their lives. So let me go to the short paragraph. The COVID-19 pandemic has reminded us that physical activity is vital to maintain the health and well-being of all, and especially of young people. This is why UNESCO launched a global flagship, Fit for Life, to promote physical and mental fitness as an ingredient for COVID-19 recovery among the young people globally. And it is under this flagship that UNESCO, in partnership with the University of Nairobi and Mount Kenya University, supported 10 students to claim Mount Kenya, the second highest mountain in Africa. The 10 students, supported by 4 staff, went through rigorous preparations of climbing 6 mountains to get acclimatized to the high altitudes under the guidance of the Outdoor Hiking Academy. I take this opportunity to congratulate them, and that is, I take this opportunity is our director. I take this opportunity to congratulate them for placing the O3+ flag at the top of Mount Kenya, where also the Constitution of Kenya is deposited. And I may add also the SDG, the the 17 SDGs are also deposited at the top of Mount Kenya. And these young people did this to claim their lives, and their future. Thank you.
I wish I had an alumni story. I'm feeling FOMO, but that's fine. At this point, what I want to do, because the students have lined up, so I'm going to once again invite Professor Geisen, and you come in the middle and we'll invite the students each. I'm actually going to... this whole campaign. We also have Oliver Olo. Well done guys on this amazing achievement. And then we have Natasha Mungai. Natasha is coming on stage. They left me so far behind the hike. So far behind, and they didn't even look like they were running out of breath. So that's a look at the students. Again, we just want to take some time to recognize them and have the media as well take some pictures. But we still have a few more people that we want to recognize. One of them just spoke, Jane Kamau. If Jane can join us on stage. Yes. And everybody who's receiving the award, please remain on stage. Mercy Mongeli, who was also giving the awards just now, she's part of the team. Well done. Natalie Margaret Odido and Micah Odido apparently are not here. So, of course, we'll recognize them in absentia. And then the final two who are going to receive these awards. These are honorary organizations that were part of this amazing exercise, and they're from the University of Nairobi and Outdoor Hub Limited. So if we can have Dr. Julius Ogengo back on stage, yes, and come in the middle and receive that, and to also have Robert Kamaru. Robert Kamaru is being appreciated as well. And that's Robert of Outdoor Hub. Adam Kabiru, do we have all the awardees? There we have it. Adam Kabiru as well. Well done. So could all of you just stand as you are? You can hold up your plaques with pride. Show the world how fit you are. Congratulations. Let the media take a few images of you. And as we said, this was part of the O3+ campaign. Our rights, our lives, our future, as Professor Geisen said earlier on. And this was a symbolic gesture. This was them hiking up Mount Kenya on behalf of everyone here, on behalf of students and young people all across the country, saying that their rights and their lives and their future matter. So y'all are champions. Is anyone going to climb again? Be honest. Yes. Wow. Nope, I'll catch up next year. But well done, everybody. Congratulations. Let's give them a big round of applause. You can return to your seats. Our speakers can return to their seats on stage as well. Thank you very much for that. Well done. And now, before we move to the vote of thanks and officially launch this day, we understand that there's some media and video clips that are going to run just now. If the team can confirm for me, these are clips of some of the activity that took place earlier today with the launch of the Gender Desk. So we'll just give you a few moments to see if you can bring those on screen. There we go. Let's take a minute to just take a look at those videos. This was part of the launch earlier on, images coming in as the first Gender Desk on campus in Kenya was launched earlier on with the Vice Chancellor as well. Let me move over here so that you can see. So the gender is for everyone, every single student, male or female. And it's the first safe space of its kind, as we mentioned earlier on, for a campus in Kenya. So this is such a pioneer moment. And as I mentioned earlier, a lot of this access wasn't there for students for so many years. And now you have the chance to access resources, a safe space, psychosocial support. So those are the images. I'm sure we'll have them on social media very soon. And now I'd like to invite the Director of Corporate Affairs for University of Nairobi, Mr. John Orindi, to thanks. And then we'll have, so welcome.
Thank you, Janet. Mine is to move a vote of thanks to our distinguished panelists, Professor Hubert Gizen, Professor Julius Ogengo, Madam Emily Opati, Dr. Anastasia Nyalita, Anne Mtavati, Agnes Ndungu, distinguished ladies and gentlemen. I want to thank all of you today for coming to be with us in the celebrations of World AIDS Day. We particularly want to thank our partners for standing with us on this day and supporting the advocacy, especially UNESCO and UN Women for giving us the support for the establishment of Gender Recovery Center. I also want to thank all the audience for your patience and for being here to make your position known, to support the cause for gender equality and for elimination of gender-based violence, all forms of gender-based violence. I want to thank the leadership of the University of Nairobi for working with us to support a safe space for students, a safe space for learning for our students, young people, and for your growth. I want to thank the students community for participating in this event today. The student leadership, especially the student council led by your president, Madam Melvin Togo. I've seen many of you here, including the governor of the main campus. Thank you so much for being here with us today. I want to thank the partners, UN Women, Nairobi County, National Endemic Disease Control, PEPFAR, the coordinating team for this event, led by our own chair, Dr. Lucy Ndai. We want to thank you very much for the leadership you've offered to make this day very successful. Thank you so much. I want to thank also the chaplaincy who have been with us today from morning till now. Please, thank you so much. The choir and the band for the entertainment you have given us and for taking us through the walk. We also want to thank you very much. The sign language interpretation team, we want to thank you very much. I also want to thank the media, all the media houses that are here covering this event. We thank you very much. If by any chance I've not mentioned you by name, please count yourself thanked, and God bless you. Thank you so much. And finally, before I even conclude, our O3+ ambassador, Janet Bugwa, we also want to thank you and everyone. Please clap for yourself.
And now we've saved the very best for last. This is the launch moment, and the only special guest who could do this. As we officially launch, she'll say a few words, we'll launch, we'll dance, we'll celebrate, and we have the honor of having Ms. Emily Opati, of course representing Her Excellency Aisha Jumwa, to come on the podium. We are honored to have her on stage, so she'll come and give the remarks, and everybody is going to join in the celebration. There's going to be confetti and pyrotechnics, so get ready for an amazing launch. But first, we have the honor of having her on stage. Karibu.
I think the Vice Chancellor, Madam Anna Mutavati, the UN Country Director, Professor, all protocols observed, all invited guests, and more important, the students. Good afternoon. Is it afternoon? Good afternoon. Are you happy to be here? Yes, I've been told I'm Opati Emily from the Ministry of Public Service, Gender and Affirmative Action, and I'm here to represent the ministry. My CS, that is Honorable Aisha Jumwa, was to be here, but because of other issues, she did not make it. But all the same, the ministry is here because what we are doing today, it is at our heart. The Ministry for Gender coordinates all the gender-related programs in the country. The Ministry for Gender also deals with the issues of economic empowerment of women. And I was happy when I heard from Madam talking about empowerment of women. I've heard from my colleague on issues of HIV. We have heard from UNESCO, and we have heard statistics that are surrounding us as we look into this. So what is important for us, as a ministry, you know, we deal with the issues of policies at that level, because we need a good environment as we implement gender-related issues. So we do policies, and these policies I cannot implement, or the ministry cannot implement the policies alone. We need all these players. We need all these partners. We need the students to implement the policies that are gender-related. And I think, let me congratulate the University of Nairobi for being the first one to have a gender desk within the university. I was among the team, I remember at Hilton, Madam Anna Mutavati, when we presented a memorandum to the Ministry of Education. I don't know whether the Ministry of Education is represented here. That is from the ministry level. It was a memorandum to do with the sex for marks. It was here, and I don't know the progress as of now, because it was handed to the Minister of Education. So when I saw the gender desk being launched, I remembered the memorandum we handed over to the Minister of Education. How far has it gone? Because students came out, they approached the ministry, they approached other partners, that this is the issue. Then I'm sure the VC, the matter is somewhere. Maybe if it's still being handled, we shall get to know that. Then number two, issues of gender, because we are within the 16 days of activism against gender-based violence. We had a national launch in Kilifi, and the CS herself was on the ground. And there are key things that were mentioned, and there are key commitments that were done during the launch of the 16 days. So coming up with a gender desk shows one of the commitments the partners and all of us are doing to ensure that we end gender-based violence within the society. Remember, as a country, we have committed ourselves to generation equality, whereby as a country, under the leadership of the Excellency, we have committed ourselves to end all forms of gender-based violence by 2026. Ladies and gentlemen, and my students here, you know we cannot end gender-based violence by 2026 if we are not working as a team. And on the part of the ministry, it has put up structures to enable you, to enable me, to enable another person to have a friendly way of reporting this matter and handling this matter and responding in a very fast way some of these issues of gender-based violence. So I believe the gender desk we have in the University of Nairobi is just one, but we are going to have others being put up in other universities. These are friendly desks. You know, sometimes we fear reporting this matter because of the stigma, as it has been mentioned, but this is a space that is very friendly, and all the services are here. If you can't move there physically, with the technology again, we have our toll-free lines, and it's not just one toll-free line. I know the one we normally talk about is 1195, which is a toll-free line to report all the gender-related cases. You can even get the psychosocial support on these toll-free lines. We have also the toll-free line with the police. And as I'm talking today, Polycare, they are also somewhere launching a very important document in relation to gender-based violence. So what we should be asking ourselves, what is the relationship between gender-based violence and HIV? That is not something for me to start explaining now. There is that relationship, and you cannot separate GBV and HIV. Then come to the issues of the mental health. So as I wind up, I'm not talking much because I don't have a written speech from my boss. I'm making my own remarks as I represent the Ministry of Public Service and Gender and Affirmative Action. Let us know that it is your responsibility, it is my responsibility to end all forms of gender-based violence. It is your responsibility within the university. It is your responsibility within the community. It is your responsibility and my responsibility, wherever you are, to ensure that issues of gender-based violence are coming to an end. I'm happy my colleague was here talking about the holiday. We are going for holiday. And for those of us who come from female genital mutilation communities, already a lot is happening. Already girls are being cut in the grazing grounds. So as we go home, because FGM is also a form of gender-based violence, as we go home, can you be your neighbors, keep your neighbors, guard your neighbor, so that all these issues are brought on the surface. As I wind up, there was a message here from the skills, and there was a message here from the team that climbed the mountain. And one of the speakers said, for you to climb a mountain, you require commitment. That is climbing the mountain. But as we also fight issues of gender-based violence, issues of HIV, we need also to climb the mountain. What is our mountain here? Our mountain here is to sacrifice and give our best in terms of ending gender-based violence. As I end up, let me congratulate again the university for hosting us today and also for making us be here to celebrate the 31st anniversary of HIV as we get into these celebrations and the services that will be offered after this meeting here. Thank you so much, and before I sit down, I want the students just to say this. Hello, hello, sema ni wajibu wangu, kukomesha dhulma. Kukomesha dhulma. It is our responsibility, it is my responsibility, it is their responsibility, it is a responsibility for all of us, and the statistics will come down. Thank you so much, be blessed, and let us continue working together.
Thank you so much. I'll now ask our guests to rise, our chief guests. I'll ask all of us to rise. All of us to rise. And now, Miss Emily, I would like you to declare that it's World AIDS Day. So on the count of 3, she's going to lead us into it. So you'll count 3, 2, 1, and you say World AIDS Day.
2, 1. Yes, 3, 2, 1. Yes, yes, we got 3, 2, 1. World AIDS Day. 3, 2, 1. World AIDS. Thank you.
Mngeendelea kidogo.